Hello, and welcome to the presentation Supporting Mobility in Nursing Home Residents. My name is Marie Boltz from the Penn State College of Nursing. I will be discussing why mobility is important, the ways that nursing home staff can help residents to be mobile, and how family can also help residents be mobile. So why worry about mobility? First, let's define mobility as the ability to move or be moved freely and easily. This applies to any part of the person's body. It's important because it's valued by older people as an important determinant of their quality of life. And it's necessary for basic activity, such as dressing and grooming, using the toilet, eating, moving one's joints. And finally, it's an important marker of health. Any sudden change in mobility or function is a common sign of an illness. So what happens with mobility as we age? When you think of mobility with our aging, you need to consider that there's an overall slowing down. The muscles lose some strength, there's less exercise tolerance, bones are less strong, and there is some decrease in height. This slowing down should not interfere with function unless there is a disease or accident causing the changes, or if the person doesn't move. You've heard the saying, most likely, that if you don't use it, you lose it. This is very appropriate when considering mobility as we age. Now, mobility is important to all of our residents. As you can see in this slide, the couple in the middle of the slide are very mobile. They're out walking on a hiking trail. Whereas the resident in the upper right corner of the slide is lifted out of bed with a Hoyer lift and needs considerable help with activities of daily living. Mobility is still important to this resident, and what we focus on is having her be out of bed and be involved with other people, also providing range of motion so that she has joint function and doesn't develop painful contractures. Now, other residents in this slide have varying levels of mobility. The gentleman who's with a small child can self-propel his own wheelchair and is encouraged to do so. The resident in the far lower left corner is getting help from a nursing assistant to get out of bed, but then will be encouraged to walk with her walker. So residents have told us about the importance of mobility. They've told us that they want help to be as independent as possible. They also stress to know what they're capable of and respect that capability and don't assume that they're not able to be mobile or not able to be functional. They also have emphasized, though, that the approach is important. One resident said, "Don't push, push, push," without paying attention to me and observing whether I'm in pain or being tired. So this resident was saying, I don't like a staff member to be aggressive, but to be respectful and attentive and help me be as capable as possible, but do that in a kind way and adapt their approach to whatever I'm feeling at the time. One resident emphasized that he is motivated when someone acts like they are caring. Now, there are some barriers to mobility to consider. The first one focuses on mind and mentation. Remember that all these barriers to mobility also can increase fall risk, so that when we're looking at promoting mobility, we're also looking at minimizing the risk of the person falling and injuring themselves. The first barrier would include cognitive impairment. Residents who have cognitive impairment are not likely to be aware of their safety needs. Also, they might be less likely to move because they're afraid of moving. Depression and low mood can make the person less mobile, as well as a fear of falling. fear of falling is a major cause of immobility because when people have fallen or are afraid of falling, they're more likely not to be inclined to be mobile again. And by being immobile, they're actually increasing their fall risk. And finally, a big factor impacting mobility is lack of motivation, feeling like there's no reason to be mobile. Immobility worsens gait and balance and also increases fall risk. Another category of barriers to mobility include medication. Too many medications can be a factor, as well as medications that cause sedation or dizziness, or medications that can affect blood pressure. I've listed some here, including meds for anxiety, known as the benzodiazepines or benzos, and they include medications such as Ativan, Xanax, Clomiphen, frequently prescribed for anxiety. Another type of medication includes antipsychotics, as well as antidepressants, narcotics, and opioids. So it's really important that we monitor these medications. One of the medications that I've not listed, but can really be a culprit in causing fall risk as well as immobility, are the drugs that contain Benadryl. And these are often over-the-counter medications, sleeping aids, and Benadryl can cause dizziness as well as sedation and increased confusion. Other barriers to mobility, of course, would include pain and other discomforts and problems with vision. And again, these barriers to mobility also cause fall risk. Now, how do nursing home staff promote mobility? Well, you've often heard the language recently about the 4M frameworks, which is really looking at factors that are really important to help the older person maintain their health and function. And they include what matters to the person, knowing what matters, evaluating medication, mentation or mind, as well as mobility. So the nursing home staff are trying to address each of these dimensions with their care planning. And regarding what matters, they want to know the person to build relationship and know what matters to motivate the person. And this requires input from the family. In terms of medication, the rule of thumb is the less medications, the better. And we monitor medications for side effects and avoid medications that contribute to falls and sedation. Now, going down to mentation/mind, we observe and report for changes in thinking and alertness. We want to help the resident get involved in activities because people often are more mobile when they're connected with other residents who are also engaged in mobility and physical activity. So social interaction is important, not just for motivation, but also to improve cognition. We want to praise accomplishments and also focus on good memories to promote that sense of well-being. And finally, focusing on mobility, we encourage physical activity in basic self-care, like brushing one's hair, dressing, range of motion, active games, exercising with light weights, transferring, walking to meals. There's some examples. Now, there's a philosophy that we try to incorporate within our work with residents that helps promote mobility, and this is function-focused care. And it's all about doing care with the resident rather than doing it for the resident. And this includes setting goals with the resident via care plans. These goals include ones related to ambulation, transfers, moving the joints with exercise, or range of motion. And range of motion basically means that another person moves the joints, and encouraging people to be involved in their own self-care, such as bathing and dressing. This philosophy focuses on what the resident can do. We often underestimate what a resident can do and immediately begin doing things for them. And it really diminishes the person's ability to be independent. Function-focused care includes all staff who work in the nursing home, who work together as a team to motivate the residents. That motivation may come from a friendship with the housekeeper or with the dietary staff, and it may be supported by those staff members, allowing the residents to be involved in things such as very light housekeeping, or with good infection control practice, helping to clear the tables. We want to focus on safe movement with function-focused care, which in turn decreases fall risk. So not merely fall prevention, but safe movement. And if we're helping people move safely, then we're building their strength and helping decrease their fall risk. So here I've listed sort of the two types of approaches. The person approach is associated with function-focused care, whereas the task approach focuses on getting the job done, completing the task, having the person be washed, but not necessarily involving the resident. As a result, the resident doesn't have the opportunity to improve in their functioning, and also doesn't have the opportunity to learn more about how they can be as functional and mobile as possible. The person approach include what matters. So we emphasize, how the person can be mobile, perhaps where they want to walk to, or what type of device they will use, or what type of activities they would be engaged in, and enables the resident to do as much as possible for themselves. The care benefits the resident. The staff provide physical and verbal cues. So many of our residents have cognitive impairment and have difficulty understanding some directions, especially if they're complex. So we need to break the directions down into small steps and sometimes provide physical cues, that is, show people, and set them up, and sometimes use hand over hand assistance. So place our hands over the residents' hands and get them started. Now, how do we respond to a resident who might think that staff get paid to do everything for them? This is often something that we hear, or a statement that we hear from staff, and we need to help staff communicate to the resident that these approaches to having the resident be as functional as possible, as mobile as possible, are out of concern for them, because we know that when they're as mobile as possible, they'll have less pain, they'll have better health, and they'll feel better about themselves. Here are some examples listed of function-focused care. They include encouraging and supporting the resident to be involved in bathing and dressing and grooming. Also having them walk to the dining room, encouraging them to do so, or walk to activities. If they're in a wheelchair, encouraging them to wheel themselves. Perhaps having light 2-pound weights available that they can use while watching TV or waiting for the hairdresser. Going to exercise classes and making sure they have devices they need, such as a walker, necessary to maintain their independence. So activity staff are key in terms of supporting mobility and physical activity. They provide activities such as walking groups. We find that when residents walk with other residents, they talk together, they may play music. This social activity motivates people to walk. Also, active games, group challenges, dancing is key. And dancing can occur for the resident who's able to stand, or if the resident is in a wheelchair, they can also dance using their upper body movements. So you can see here, these are some of the activities that we use to promote physical activity. Certainly some of these were on hold during the pandemic, but our nursing homes are getting back to them. Chair activity bingo is a popular one. So instead of the traditional passive activity where the resident sits and waits for someone to call out a number, they have exercise right embedded within the bingo activity. And you can see here some active games. Now, helping activities are another way that residents can maintain mobility. And these are activities that are particularly useful in people who are living with dementia, because people who are living with dementia typically retain their what we call procedural memory. That is sort of like muscle memory. They remember things that they did over and over again on a routine basis. So many residents like to help, so they feel productive in doing that. And also because it's a normal, natural activity, it comes back to them and they can do it spontaneously. Some of these activities include folding cloths or towels, pushing a lightweight vacuum, as you can see here on the right, dusting, watering the plants, setting the tables, again with support from staff where they have good infection control technique. They need to wear gloves, and raking leaves if they're physically able. So these are the kinds of things that residents often really enjoy doing, and it comes to them naturally. So you want to ask yourself, are you comfortable with these helping activities? Remember that if the nursing home staff are suggesting it, they're not looking for ways to secure labor, free labor from the residents, but they're trying to promote a sense of community and connectivity while promoting physical activity with the resident. So we know that families are key for helping residents be mobile. And what I'd like you to consider is, what are some of the challenges you face in promoting your residents' mobility? It might include that you're worried about many other things, and this isn't a priority. Or you consider that the residents are too frail, or I think they should rest, or I'm afraid of them falling, or they aren't motivated. So these are the common things we think about when we're promoting activity. And let's look at each one of them and see how we can address them. So in terms of mobility isn't a priority, we know that helping residents move helps prevent pain and disfigurement, poor mood, and poor appetite. So it does need to be a priority, and it needs to be embedded in our plan. If we plan carefully, we can include physical activity into any of our time together. It might mean a walk, it might mean movement to music while you're visiting, encouraging the resident to brush their hair, or maybe helping them organize a closet, taking things in and out and replacing them. Another attitudinal area that we need to address is thinking that the resident is too frail. If the resident has had a paralysis, a recent fall, an injury, or seems weak, yes, we do need to consider what their capability is. So it's important to check with the nurse and or physical therapist for simple, gentle exercises for the resident who experiences these conditions. Fear of falling. Well, I've said before that not moving the resident increases the risk of falling. It's important to provide safe, supervised mobility, and supervision is key. The need for rest is a consideration, and we need to remember that sleep will be better if the person is involved in physical activity. And we tend to think that older people require a lot of sleep, or sometimes less sleep. But in reality, older people require about the same amount of sleep, about 7 to 8 hours a day, as younger people. And that's on average and in typical conditions. Now, the person might have a medical condition where they sleep more. Some older adults need to pace themselves. So we might look at the person and say, oh, they're short of breath, or they got very tired. What we need to do is not restrict physical activity, but instead say stop and rest, and then resume the physical activity and pace themselves. So the biggest challenge of all in working with ourselves to be physically active, as well as our residents, is motivation. And what we have found as important sort of useful tips is letting the resident know you want them to be mobile because you really care about them. And reinforce that's why the staff encourage self-care. Use humor, laugh, have fun with the resident, get excited when they do any of the recommended activities, something as simple as going to an exercise group. Encourage involvement with others, including family and friends and other residents. Walk together, share activities and successes with families and friends so that they're then reinforcing that positive attitude with the resident. And identify some motivators as goals, like going out to lunch, or going outside and having a bite to eat when the weather is nice and restrictions are lifted. Here are some other ways that families support mobility. First of all, and this is very, very important, is really being eyes and ears for the staff and watching and reporting changes in ability to think, changes in mood or function, because these can signify that the person is experiencing delirium, which is acute confusion that accompanies an acute illness. So when a person is delirious, they have an underlying serious medical problem. These kinds of changes can also signify depression and other medical causes that need prompt attention. So remember, early on in this presentation, I said that mobility and function are really important markers of health. A second way, additional way families support mobility is attending and participating in care conferences, helping us to know your family member, helping them express what matters to them, and helping set specific goals. For example, walk into the dining room 3 times a day. We also have to figure out the best language to encourage them and praise them to meeting these goals. And finally, if your family member has been hospitalized, remember the goals to get them back to the level of mobility that they had prior to the hospitalization. And often for a week or so prior to going into the hospital, the person might be changing or experiencing these very subtle changes in mobility. There might be sudden, very sort of gradual and vague changes. So by detecting them, we might be able to prevent the hospitalization. However, if they are hospitalized, we want to get them back to the level they were before they got sick or before they had the injury. So during your visits, consider going for a walk when possible. Encourage exercise. A lot of our families enjoy applying lotion to their residents' hands and arms and gently moving the joints, stopping if they're pain. Ask about the use of 2-pound weights to strengthen their arms. Also encourage range of motion. Do this with them, this exercise with them, and perhaps do it to music, lifting arms over the head, as this woman is doing over here in the photo. Put the hands behind the head and march in place. Encourage sprucing up. Again, those normal, natural things, brushing their hair, other grooming. Go to group activities and ask your family member to help. Maybe hand out the supplies or the snacks or the bingo cards. Encourage joining the group active games and exercise. A lot of our activities historically in nursing homes have been passive. They've been church services or music or entertaining or discussions, all which are perfectly wonderful to promote socialization and to help the resident, be involved. But we want to find out ways that we can sneak in movement and physical activity during times people come together. So group active games and exercise are important. When you visit, you could throw a beach ball back and forth or play soft horseshoes or merely dance. So here are some key takeaways. We try to help all residents to be as mobile as possible within what their level of capability is. And this includes walking, moving in bed, moving to a chair, moving their joints, bathing and dressing, exercising, doing normal things, and fun activities. Important things to consider are that medications and their mental status and sense of well-being impact mobility, and we need to be watchful and intervene as soon as we find changes. Families are key in finding ways to help the resident be mobile, help the resident describe their preferences and ability, and also encourage and motivate the resident. So I really want to thank you for your time, and I encourage you to help us think what we need to do more and need to do better to help our residents be mobile.